When we're talking about lifestyle-based diseases, we're really talking about diabetes, we're talking about high cholesterol, individuals with metabolic syndrome, and these diseases really have an effect on an individual. As you can imagine, they affect the quality of life for the individual, and so the quality of work is also affected. When we look at productivity measures like presenteeism and absenteeism, we know that, for example, patients with diabetes, when you have the diagnosis of diabetes, you're about 3 to 6 times more likely to have absenteeism from work. What we're seeing a lot more in our clinics is patients that don't feel a sense of control when they've been given the diagnosis of diabetes. They might feel stress, anxiety, depression related to their new diagnosis or their continuing management of the diagnosis of diabetes. So when you add on depression to diabetes, now you have more than a 10-fold risk of absenteeism from work. So it really does have a very negative impact on work for employees. Individualized coaching is the best way to sustain long-term results. So we've seen this in our clinics multiple times, and it makes sense. You have somebody who's dedicated, who's working with you one-on-one to identify barriers that you have on why you're not able to incorporate a healthy diet or exercise or follow your medication regimen. So this person's working with you one-on-one to identify these barriers so that you're able to overcome these barriers. And I think the individual coach also works with you very well to help you to understand that there will be setbacks, and these setbacks are expected, but here are the tools that we can use to get you back on track. So when you're talking about the utilization of healthcare, individuals that have gone through personalized health coaching tend to use instead of using the emergency room as their primary care, they use their primary care and their endocrinologist appropriately, and claim costs, the financial incentives down the road from that are huge for employers because they're not using the emergency room as their primary care. This was like such a great study that we did. We, again, used personalized health coaches throughout many of our clinics, but in this particular one, we did a 12-week study. We had 29 individuals who were all considered high risk, and they were considered high risk because they either had really uncontrolled heart disease, diabetes, metabolic syndrome, and so they enrolled voluntarily. There was no financial incentive given to these folks, and they were told, come to the program, you'll be given individualized coaching where we'll talk about your diet, physical activity, and we'll also do something called mindfulness training. So we'll hopefully help with some of the stress that comes along with some of these diagnoses. And I think the most exciting part was we saw statistically significant results in their blood pressure. So their blood pressure after 12 weeks of the program had gone down. On average, each individual lost about 8 pounds. Which I think was incredible. So there's weight loss, there's a BMI that was improved, there was waist circumference that was improved. Studies that have been done similar to this have shown that even after the 12-week intensive individualized coaching, as long as you're following up and providing some support for these individuals, they can sustain these results for up to 12 to 18 months and probably longer. It's just the study duration was 12 to 18 months. So that's really exciting. You're really getting to the core of why people were having these barriers and how they are able to tackle them once they have the right tools.